Hi, this is Rockey again, and in my previous 3 videos regarding sleep apnea, of course, we went over its definition, we went over its signs and symptoms, we went over the importance of why you might want to get screened and tested, we went over the testing procedures, went over the results of the test, and now we officially on paper have a diagnosis, and it's up to us working with a patient and working with a medical doctor to come up with a treatment plan for that. Given that number that we had at the very top of the last page, the sleep report, which I said was the holy grail of what we do when we test, we get a number, an AHI number, and we have ranges here, 5 to 15 or 5 to up to 15. We call that mild. Moderate, of course, is 15 to up to 30, and 30 and above, we call that severe. Now, the medical professional that's making the diagnosis is going to make recommendations for your treatment based on this AHI number and your score. Of course, if you're less than 5 and there really aren't any symptoms, I suppose you're going to be okay and not be required to do anything. But when you at least have some apnea, that's when treatment should occur. The severe cases here, generally speaking, the medical professional is going to recommend that you use a machine called a CPAP machine. A lot of people have probably heard them, some people heard about them, some people have seen them, seen pictures. The reason that those severe, above 30 people this is recommended to is the fact that CPAP machine is really, in my opinion, 100% effective. There's a pump here that forces air down the airway and it opens up that blockage, and it does that rhythmically overnight, and it helps you breathe overnight. In my mind, a CPAP machine is 100% effective in solving the problems. That is the standard of care today in those severe patients and even in some of the moderate cases. And we wait for the diagnosis and we wait for the treatment recommendations from the medical doctor to help us follow along those paths. The real issue from me, having done almost 30 years worth of sleep dentistry, is that 1/2 to 3/4 of the patients that were dispensed CPAP machines after 1 year aren't using them. We have the issue of somebody that's severe or maybe even moderate that was recommended they have a machine, which we know is effective, but due to cumbersome issues, claustrophobic issues, noise issues, travel issues, not wanting to hassle issues, whatever it might be, patients aren't using them, and then unfortunately that leaves them untreated. For those patients that are mild cases, and for those patients that are intolerant to using the CPAP machine, that presents an opportunity for us as dentists to be able to make appliances, we call oral sleep apnea appliances, that would help in the treatment of those patients. We have many different kinds here. They all kind of fall into a similar category of causing the lower jaw to be able to be pushed forward. Many different styles and shapes and sizes and thicknesses and all of that. But generally speaking, what they serve to do is bring the lower jaw forward slightly at night, opening the airway. You can see where here the lower jaw has dropped back, the tongue is attached to the lower jaw, it drops back, the air can no longer pass through. So if we put an appliance in there that brings the lower jaw, we call it mandibular advancement device, brings that forward at night, we drag the tongue forward, we open this up, and this usually works pretty well for those cases that are mild sleep apnea and for those patients that are CPAP intolerant. This allows us to be part of the treatment protocol if necessary. And it's really important that if you've got certain signs like overweight, a large neck size, a heavy snore, your medical doctor is wondering about why your blood pressure is going up, blood sugar issues, I urge you to take that seriously and get tested, get screened, get tested for whether you might have an apnea component or not. It's very serious. We're here to help you for that, to help screen and get you going in the right direction, and minimally education as to why it's important. So thank you for listening, and I wish you well in your journey. Thank you.